Hello, my name is Cameron Cabrera, and I created an animation to talk about and illustrate my experiences at both SVS Vision and the Skin and Hair Center. I wanted to create this type of presentation to combine my love of art and my passion for medicine. I was given the opportunity to intern at two incredible offices here. Beginning in the summer and continuing into this past semester, I worked as a scribe at SVS Vision. My main job while interning at SVS was to be a medical scribe. This consisted of inputting information about patient history, prescriptions, and eye health into the EHR system. To begin, I'm going to talk about the different types of exams. Routine exams are the most typical type of exams we see. Before Dr. Cabrera can see a patient, there are three pretests that are performed by the opticians. The first pretest is performed on the autorefractor. The autorefractor displays a hot air balloon going in and out of focus to gauge how light is affected as it reflects through the patient's eyes in order to give an estimated prescription. These estimates are helpful when there are new or established patients as they give the doctor information regarding the patient's refractive status, whether the patient needs an initial prescription or an updated prescription in their glasses or contacts. The other pretest machine is the tonometer. This machine puffs a bit of air into the eye to test the intraocular pressures. It measures the amount of air that contacts the eye in comparison to the amount that returns. This difference is the net internal pressure within the eye, or the intraocular pressure. This is important because certain ocular pressures can indicate glaucoma or damage to the optic nerve. If requested, the patient can also have images of their retina captured. The camera's flash enters the eye through the pupil, allowing for the image to show the inside of the eye called the retina. After the data is entered into the EHR system, one of my jobs is to put the patient's prescription into the phoropter, which is essentially a big pair of glasses so that Dr. Cabrera could check how well the patient was seeing with the autorefractor prescription or their current eyeglass prescription. After which the prescription is altered to ensure the patient can see 20/20 or as close to that as they can get. After the prescription is determined, Dr. Cabrera looks at the health of the eyes using a slit lamp that shines a bright light into the eye so Dr. Cabrera can look for any abnormalities in the back of the eye. In some instances, he will also have to dilate the eyes to be able to have a more comprehensive view of the retina with an instrument called a binocular indirect ophthalmoscope. This allows Dr. Cabrera to see the retina in 3D in the extreme periphery of the retina in order to rule out retinal disease, detachments, and tumors. He will also run ancillary tests with his pen light to rule out binocular and neurological disorders. Finally, Dr. Cabrera will go over any changes in the prescription or in the health of the patient's eyes. Next is the contact lens exam. This exam is similar to the routine exam, except at the end of the exam, Dr. Cabrera puts in the prescription for contacts, and if possible, trial lenses are given to the patient and their acuities are tested, along with checking that the contacts are centered, comfortable, and not rotated. There is also a contact lens recheck. Contact lens recheck exams are required for any patient with contacts. It is required that the doctor sees the contacts on the patient to confirm the vision. These are typically short exams as the patient reads the chart and Dr. Cabrera looks at how they are fitting on the eyes and if they are rotated at all. Occasionally, the exams are slightly longer if corrections on the prescription are needed. Senior exams are practically the same as routine exams. However, it is required that all patients above the age of 65 are dilated to check the health of their eyes. Dilation exams typically are given to patients over the age of 65, patients with particularly high prescriptions, i.e. over -6, to look at retinal detachment. To dilate a patient's eyes, typically a 0.5 to 1% tropicamide and 0.5% proparacaine drops are used. Proparacaine is put in first as it is an anesthetic that numbs the eye because tropicamide drops that enlarge the pupils can sometimes burn. After the drops are put in, it takes about 30 minutes to dilate. After those 30 minutes, Dr. Cabrera uses the slit lamp to look into the back of the eye again and look for any abnormalities. Some eye conditions that we came into contact with were meibomitis, which is an eyelid infection that is treated with warm compresses or medications depending on the severity, dry eyes, which is treated with cyclosporin, immunosuppressive drug, or over-the-counter drops, glaucoma, which is an increase in pressure of the eye causing loss of vision. It is sometimes treatable with eye drops to lower pressure, however, glaucoma suspect patients are referred out for treatment. Diabetic retinopathy, which is where diabetes can cause cataracts, retinal detachment, and makes patients more susceptible to retinal manifestations and loss of vision. To prevent this, it is important to keep the diabetes under control by having an A1C under 7, and if the A1C is over 7, we refer the patient out because an A1C that is over 7 is too unstable, and we cannot fit patients for glasses because their prescription will keep changing until they are stable. Retinal hole is a hole in the retina, and depending on the severity, it is either observed or it can be treated so that it doesn't advance into a tear. Retinal detachment is, as the name says, when the retina detaches, and if it is not treated within hours, it can lead to permanent blindness. So patients with a retinal detachment are referred out to an ophthalmologist. Cataracts are a clouding of the lens of the eye, and it is not particularly urgent, but if it is causing quite a bit of vision loss, then it is referred out to an ophthalmologist where they replace the intraocular lens with an implant. Lid lesions are either cysts or neoplasms that are biopsied to determine if they are malignant. Macular degeneration is an accumulation of drusen in the macula, which can cause loss of vision, and if it is bleeding, we refer out to injections. The dry type is treated with multivitamins and referred to specialists. Astigmatism is an irregularity in the shape of the eyes. Instead of being circular, it's oval, which can cause glare, halos around lights, and poor night vision. This can be corrected with glasses and contacts. Eye infections like conjunctivitis are due to inflammation and irritation and are treated with antibiotics. Near the end of October, I began interning at the Skin and Hair Center, which is run by Dr. Meena Singh and her amazing staff. I had the opportunity to see many different exams and learn about the vast field of dermatology. While interning, I assisted with writing down voicemails, calling patients about appointments, cleaning and sterilizing medical instruments, stocking supplies, shredding documents, scanning papers, and resetting patient exam rooms. Other than that, I mostly shadowed Dr. Singh during exams. During skin checks, the patient is instructed to put on a gown and Dr. Singh will examine the skin looking for any abnormalities, after which Dr. Singh will diagnose and create a treatment regimen if needed. Sometimes during skin checks, Dr. Singh will need to take a biopsy of any abnormalities. Biopsies are done to help diagnose an abnormal area of the skin. A biopsy is completed by using a round-tipped cutting tool to remove a small amount of skin. Depending on how much skin is removed, some stitches may be needed to close the wound. From there, a rotary microtome, which is a tool used to cut thin sections of tissue samples. After sections are cut, they're put into dyes to make certain parts of the sample different colors, after which Dr. Singh will look at the sample under a microscope and diagnose it. For hair loss consultations, Dr. Singh will assess the pattern of hair loss and come up with a treatment plan. At the clinic, they offer many different pathways to regrowing hair after hair loss. A few that I learned about were PRP injections, which stands for platelet-rich plasma, which involves using the patient's blood to promote regeneration and healing by concentrating platelets and injecting them into the scalp to regrow the hair. This process can take up to 3 months to see results, and there are different options to how many injections the patient wants to undergo. Another treatment I learned about was an oral medication called dutasteride. Dr. Singh explained that this drug is meant to stop male pattern baldness, which is a thinning of the hair around the hairline and crown. This medication reduces the levels of dihydrotestosterone, which is a hormone that causes hair follicles to shrink. Another treatment offered at the clinic is the Trichopat. The Trichopat uses mechanical, electrical, and light stimulation to deliver growth factors and stimulate the scalp. It activates dormant hair follicles and improves circulation. Along with hair loss treatments, Dr. Singh also offers lip injections, Botox, acne treatments, laser hair removals, mole removals, and much more. I was given the opportunity to sit in on a few of these appointments. During a lip injection appointment, Dr. Singh prides herself in ensuring the patient still retains a natural look. She is very careful not to overfill while making the lips look fuller and even. To do this, the patient goes through a consultation to explain the desired look. Then the patient is numbed, after which Dr. Singh will begin the injections, making sure to show the patient the lips throughout the procedure to achieve the patient's desired look. During acne consultations, Dr. Singh assesses the affected areas and determines a treatment regimen. A few of these treatments that I saw include laser, chemical peels, and acne extractions. The laser can help treat hyperpigmentation, whiteheads, blackheads, pimples, and scarring. Chemical peels induce exfoliation and remove damaged skin. Extractions are performed by putting gentle pressure around the pore opening and extracting its contents. Along with these treatments, Dr. Singh also can provide a treatment regimen that involves different skincare products to help target the issues. I had a wonderful experience and I'm so grateful for the opportunities at both SVS Vision and the Skin and Hair Center. I chose to make this animation to best illustrate both of my experiences and show my passion for art. I'm excited to pursue a career in the medical field and I'm definitely interested in dermatology and I love the environment and working with Dr. Singh and Dr. Cabrera. I want to thank Mr. Elnif and Mr. Surgeon for helping me throughout these 4 years of high school and Miss Nail for giving me this opportunity. I also want to thank my friends and family for supporting me throughout these 4 years of high school.